Good morning, good afternoon, or good evening from wherever you are. This is a University of Liverpool online live webinar. My name is Michael, and I'm more than happy to host today's webinar on the topic of public health matters. Here at Liverpool Online, we have quite a range of online master's programs, but the particular one that we usually also see a lot of research being done and a lot of good research that actually impacts day-to-day lives is the public health masters. And with this in mind, we wanted to sit down with one of our graduates on the public health masters program, and we want to delve in a bit into her experience and her learning journey, to look at what kind of dissertation she did, and as well to see how her master's in public health is helping her currently in her career, and of course in the future things that she wants to do. Before we introduce our guest speaker today, I just wanted to remind everyone that today is a live Q&A webinar. So if you have any questions that are related to today's topic, both for myself or for our guest speaker, please put all your questions down in the Q&A box. And towards the end of the webinar, if time allows us, we will pick one or two questions and we'll try to answer them live. So with this in mind, I want to introduce today's speaker. Mathilde Regnault. She is a graduate on our Masters of Public Health, and I want to give her a warm welcome. Welcome, Mathilde.
Thank you, Michael. Hi.
How are you? Can you please tell us where you're broadcasting right now, and a bit about yourself, what you're doing right now, and a bit about the program that you've studied with the University of Liverpool.
Okay, so hello everyone from Paris. I'm in Paris today, where it's not very sunny, but still quite warm. Today I'm the deputy head of communications at Institut Curie, which is a comprehensive cancer center in Paris. And I studied an online MPH at University of Liverpool Online from 2014 to last December. And I did my dissertation on breast cancer because that's my main topic of interest.
Okay, and we're going to find out a bit more about that just later. But first, I think that the first question that everyone wants to ask, especially for someone who has finished an online degree, is, why did you choose an online degree? And because we know that there are a lot of MPH programs out there by different universities being delivered online, of course, our curiosity is what determined you to study with the University of Liverpool Online?
Okay, so maybe the first step is that, first of all, I was a health journalist, and then I decided to be more involved in projects. And so I thought that I needed to go back to study and to have like a degree to make it more, serious. So I started to look at different masters in public health. I knew I wanted to do it in English, even if I'm French and living in France, because I wanted something that would be internationally recognized. I also wanted to do it online because I couldn't afford to leave my job for 1 or 2 years. And I wanted it from a well-renowned university because, it's going to be important for my future. So I started doing a lot of research online to check what were the interesting masters, how much they cost, of course, and also how serious the university was. And so University of Liverpool seemed like the best choice. So I applied, and that actually was my only choice. I didn't apply to any other universities.
Okay, and what kind of criteria were you looking for when you are doing your research?
So how renowned the university was in this specific field, public health. I wanted English-speaking university, and preferably in the UK. And I wanted a university where the way the studies were organized would allow me both to keep working full-time and also to interact a lot with other students. It was important to me. So the University of Liverpool really had all these criteria. And so the choice for me was easy. After that, my only question was, am I going to be accepted? Because you need to show that you're really motivated and that you're interested and that you're going to be a good student. So I was really thrilled when I received the positive answer.
Of course, and knowing now that you actually did manage to go through it and finish it, you were quite motivated.
I was.
What was your motivation specifically to go for public health? You are working for an institute that works with public health, but why did you decide to go for a full master's program?
Because I wanted to do more. I wanted to really help people to help themselves. I mean, I don't want to do things for them. I want them to realize how important to take care of their own health. And so I wanted to help them get the clues to do that properly, you know, because it's not that easy. It might seem easy when you're healthy and you know what to eat or how much sport you should do, but it's not something that's, you know, like that. You need to learn it. So that's what I wanted to do, be more involved in projects that would help people being empowered.
Okay. And you did mention that you did your research on breast cancer, and we do want to congratulate you that we know that you have won an award for your Dissertation of the Year award. Can you let our audience know a bit about, you know, the motivation of picking up this specific research topic, and what was your process of going through the research?
Okay, so my topic was the prevalence of distress in breast cancer survivors. The reason why I chose this topic was first because I thought, and I was wrong, that it was going to be easier because I work for a cancer center. It turned out it was not that easy at all because I couldn't use the cancer center data because I'm not a doctor anyways. And also because I was really interested in this topic because I knew that there were a lot of things to do in the post-cancer phase. In France, and I think in lots of countries around the world, the cancer patient is like in a real path when he's in the hospital or being treated. But once he's cured, there is nothing organized for him. And I knew that for a lot of patients, it's like a real issue. It's very difficult to go back to your previous life, the life you had before you got cancer. And so I really wanted to do something on this specific part of the treatment path. I chose breast cancer because it's the first cancer in women in France, and I think in most countries in the world. And it's a cancer that is cured, I would say, almost easily, in the sense that there is 90% of the patients get cured in the end. And so there are a lot of survivors from breast cancers, and usually they are quite young. So there are lots of things that they can still do, like working, take care of their family, just enjoying life. And so it's a big issue for breast cancer survivors.
Okay, brilliant. Sorry, go on.
So that was my topic. And so I decided, because it's a quantitative study, I had to recruit a lot of patients or ex-patients, and I had no access to any database because I'm not a doctor. And you need to be a doctor or a nurse here mostly, or to work for a cancer center to access the database of patients. So I decided to recruit them online, which is where I mixed both my public health skills and my communication skills, because I work for online communications. And so I recruited them online from a questionnaire and a website that I created and that I promoted on Facebook and Twitter. And it actually worked quite well. I recruited about 500 patients in 2 days, which was really unexpected. I really thought it would take much more time. And so after that, I only had to analyze. I say only had because it's really actually not the most difficult part, to analyze the data and then to write the dissertation. The most difficult part, I think, in the dissertation for me was to write the proposal and to have it accepted, because of my recruitment method that is not very well known, or that is not very, that people don't do it very often. It was very difficult for me to explain how I was going to do it, how it was going to work, and to make sure that patients' confidentiality would be respected and that they would access the results easily. So it was a very long path, but it turned out well in the end.
It did turn out well, and we really want to congratulate. I mean, that is show of creativity, of perseverance, and you did get to win an award for your dissertation. So that is really wonderful work. The next question that we do have is, we know that we've had a previous conversation a bit about the results of your study, and you did mention that they were quite unexpected to you. Can you give us a bit of insight on the results of the research?
Yes, well, I knew that I would have, well, I suspected I would have an important percentage of distressed persons in my sample, because the previous studies, either in France or other countries, showed between, I would say, 30 and 50% of distressed people in the sample. But in my sample, almost 2/3 of the persons who answered the questionnaire were distressed, and seriously distressed. So it was really a high percentage that I didn't expect. And then I also investigated the risk factors associated to this distress. And some of them were not really expected. In other studies, it showed that, for example, younger women were more distressed, the ones who had a relapse, of course, that kind of things. But in my study, other things showed up that I didn't really expect. Like, for example, the women who had their lymph nodes removed. When you have breast cancer, they remove the lymph nodes from your arm sometimes if the cancer has started to spread. So these women were more distressed, which can be explained by many factors, including the fact that they have more symptoms after the cancer, like arm swelling, that kind of things. Those who had undergone hormone therapy were also more distressed, and also had more physical symptoms, which can be explained because hormone therapy kind of shuts down the hormone system, female hormone system in women, so it has different consequences. Women who had undergone breast reconstruction after a mastectomy were also more distressed. This is related to body image issues that can happen after breast cancer, because you have to reconstruct yourself both physically and mentally, so it's really difficult. And so but that could be maybe more expected. Those who were on sick leave for more than 6 months were also more distressed, but you can assume that if they're still on sick leave, it's because they have lots of different issues going on. So.
Okay, very interesting findings, and I'm guessing that this probably is why it contributed to the process of going through the dissertation, and also to you winning an award. So it is quite interesting, and it's the approach that you took is really admirable.
Thank you.
Okay, so we've talked about your motivation, and we looked at your dissertation and your research. What we also want to know, and I'm very curious as well, is what did you find enjoyable in the learning experience? How, if you would look at it now, back 2.5 years, what were the key things that you can take from the experience?
Okay, so well, the first thing I would like to say is that for people who would be interested in starting MPH, it requires a lot of time. It's like 10 to 15 hours a week, but I never ever regretted starting it. Every minute was really worth it. You need to be aware of that, because you need to make time for it. Otherwise, you're going to be frustrated, and it's not good. But honestly, I never regretted. The way their learning is organized is really efficient. You have modules on different topics, and then the modules are divided into units. And for each unit of 2 weeks, you have to hand in assignments. Some are group assignments, others are individual assignments, and you get grades every 2 weeks. So it can be a bit stressful in the beginning, especially if you finished your studies a long time ago and you're not used to it anymore. But it's really a good way to make sure that you work regularly, which otherwise I probably wouldn't have done, and also to have some feedback on your work, which is always good because you can improve yourself this way. What I really liked the best about the MPH were the group discussions and work, because we are students from all over the world, really, with very different backgrounds, very different perspectives on each topic. And so it's very, very interesting and rewarding discussing these topics together. And it's honestly always happens in the very open-minded way. So it's really non-judgmental. You feel really comfortable saying whatever you think and getting some feedback from other students. And I think maybe it's probably the thing that I miss the most from the MPH. It's the group discussions and the international environments. Actually, it was also really good meeting some of the students, either during the MPH. I met them for real in real life when they came to Paris, or when sometimes I visited them in their countries, and also meeting others during the graduation ceremonies. And by the way, I really recommend for those who would start an MPH and not consider going to the graduation, that they should really go. It's really like a really rewarding moment, because you meet other students, and also because it's like, I don't know, a reward for all the work you've done before. It becomes really real.
And I'm guessing that the network that you've formed is actually helping you and supporting you even now, and you're getting a lot from these connections that you've had.
Yeah, exactly. Both, of course, as friends and also professionally. Like, for example, I wanted, because I have this MPH now, but I don't really have any PH experience. So I wanted to do an internship somewhere so that I could, have real PH experience in the field, or in a PH organization. And so I started sending out my CV to my colleagues. And thanks to one of them who works, or who used to work at WHO, I got an internship there, in the TDR service. And so I'm going to do a 2-month internship in Geneva in October and November. So I'm really, really happy.
Oh, congratulations. And it is the World Health Organization, and that is, public health at its best.
Hopefully.
Hopefully. And you are looking forward to it. It's going to be this autumn, right?
Yeah.
Good. Okay, so we've looked at, your studies. We've looked at the fact that you've went through this incredible research project. We've looked at your motivation. What's next? How do you see this degree helping you in your career and helping you, achieve the goals that you've set out to achieve?
That's a good question. First of all, I want to help patients first. The ones who helped me doing my dissertation, I want to publish the results, which I promised I would do anyways. So I will publish them on the website I created for the dissertation, of course. I will publish it through the associations that helped me publish the questionnaire. I will also try to publish it in a peer-reviewed journal in oncology, so that it makes it more official that the results are important and should be, investigated in depth. This should help maybe, put the attention of the organizations, the cancer organizations in France, on this specific topic of the after cancer phase, hopefully. So that's for the follow-up on the dissertation. And then, of course, in the medium or long term, I would really like to be more involved in public health projects, if possible, internationally. So I'm just waiting to have my internship experience, work a little more. I also have a lot of projects going on here at work that I can't leave just like that. But maybe in 1 or 2 years from now, I would really like to, find a real job in public health, maybe in program management, or why not maybe in research? I'm not sure yet.
Okay. Has your current organization shown interest in the study that you did?
Yes, they have, but it's complicated, to be in communications and then to start doing research here. So they're interested, and mostly I think they're interested in the fact that I have projects. It's always good in an organization to have people who want to move on. So I think it helped me a lot this way, even for my actual job now. Showing that I can do several things at the same time, that I can have research from beginning to end, that kind of things. Even if I don't really work in public health right now, it still showed what I was able to do. So
brilliant. Okay, so we've reached more or less the end of the questions that we've had, but we do have a couple of questions coming from the audience. And towards the end, we also have a short poll that we want to ask our audience to kind of share their experience. So, Mathilde, let me just pull a couple of questions from our audience because they are interesting. So we have one from Ali. And he is asking, what do you think that are the major health concerns affecting people today?
Well, first of all, I think it probably also depends on what type of country you're in, because low-income countries and high-income countries have different issues. But mostly, I would say that probably, at least in high-income countries, the main public health issue is overweight, and related to that, the way we eat, the way we drink, do sports, all that kind of things, which is actually quite interesting because lots of diseases come from these bad, habits, unhealthy habits, and we have the power to change them. So I find it quite positive because if we decide to change the way we drink, live, eat, we can also improve our health. After that, in low-income countries, I think it's a bit different, although in some countries it's starting to change and overweight is becoming also an important issue with all the related disease. It's not only overweight, it's also heart problems, diabetes, that kind of, disease that are clearly related to the way we eat. And also, of course, in low-income countries, lots of disease related to, I'm thinking of, for example, malaria, lots of disease that could maybe be cured if we had more, just maybe more money to research and to fight them.
Okay, well, thank you for sharing your answer. Another question from Omar asks more in terms of time management. So you had a full-time job. You did also the study on top. How did you manage work with studies? What was the secret there?
Sometimes I was sleep deprived, I must say, but it really depends on some modules actually. Some of them are really okay in the sense that it's still always a lot of work, but you can organize working on weekends and then, during the week working just during the day and have your nights for yourselves. But some other modules require more work, and then that's where you need to be really motivated because, well, it's not always easy. You have to sometimes cancel, the dinner that you had planned, that kind of things. But it's really honestly worth it. It's just that I would recommend to keep having a social life because otherwise it can become, a bit stressful. So try to manage to have some time for yourself and be prepared sometimes to spend your weekends working, even if it's sunny outside. But it's not, and that's where the support from other students is really important because we're all in the same, train doing this. So it really helps to know that other students are doing the same thing, are being sleep deprived too, and we can share, the difficulties that we meet. It's really helpful.
Brilliant. And of course, everything has to come in balance. Good. I'm guessing that you've had the experience of also learning on a campus, in a campus kind of environment. And another question that we have is what do you think is the difference? If you can compare the campus experience with the online experience, what do you think are the major differences there?
I would say that the main difference to me is that it's much more flexible to work online because you can study whenever you want. So very frequently I would work at night between 10 p.m. and 2 a.m. because that's when I'm the more efficient, which of course I would never have been able to do if I had like real on-campus courses. You have to attend them when they are. So yes, I would say that's the main difference. And also, but I've studied in France and in Canada, so I've never studied in another UK university. So I don't know if it's really a good comparison, but I found the studies here very very really well organized and with a lot of follow-up and help from the teachers. They were always here to answer our questions, to give feedback, very precise feedback, so it's very useful. Yeah, they were always available for us, and that was another difference with the other universities I went to.
Brilliant. Okay, in the few minutes that we still have, I'm going to ask my producer Derval to pull up the poll question. We do have a poll question for our audience.
Okay.
Just give us a couple of seconds. Okay, so the question is, I am interested in studying for a master's in public health online too, and you have one of the 4 options: further my career in the field, make a difference in my community, learn best practices from all over the world, or collaborate with like-minded health professionals. So please choose one of the options that you have on the screen. And while the poll is running, and we're giving our audience a bit of time to choose one of the options, I just have a curiosity for you, Mathilde, in relations to your, your research outcomes. Do you think that what you've discovered will have an applicable, will be, you can apply it somewhere. You can go with your research to a specific organization and help them better deal with post-treatment for cancer patients?
Yes, exactly. I'm hoping to go to, we have several cancer organizations here, including one of them, which is like a public organization that is defining the strategy to fight cancer. And my goal is to go to them and to show them that there is a real need for psychological screening at the end of the cancer treatment, to kind of detect the people who are the most distressed and to provide them with help after the cancer phase, and also to convince. I would like to convince them, but of course it's not that easy. But I would like to help convince them that it is important to have some kind of program for the after cancer phase, not just a 6-month follow-up to screen for relapse, but also a follow-up to screen for distress or psychological issues.
Okay, brilliant. And I hope that you'll manage to actually do that, because it is an important research. Okay, so here we have on the screen your answers. So about it's between 42 and 42%. So people said that they both want to further their career in the field and make a difference in the community, which is really, really good. And also 17% of people said that they want to learn best practices from all over the world. So this is a good place for you to actually manage all of these expectations. It is a very, very high-end master's programs in public health. And as you saw, Mathilde's success story, you get all of these aspects in the MPH here at the University of Liverpool online programs. Now, before we close today, I just want to leave with one final question for you, Mathilde. And we usually like to ask all of our students and graduates this question. So if you would give one piece of advice to anyone who's looking into getting into an online degree, and in your case, in an online degree with the public health program, what would that advice be?
Maybe I would have 2 or 3 actually. First, make sure you're going to have enough time in the next 2 or 3 years, because it's really important if you want to succeed. And then when you're looking for your MPH and your university, make sure that if you're studying online, your degree is going to be recognized the same way that the on-campus degree is recognized, which is the case with University of Liverpool. So that's one of the other reasons why I chose it. Yeah, maybe that's my 2 pieces of advice.
Perfect. Well, thank you so much, Mathilde, for joining us. And thank you for everyone who has joined us to listen to this University of Liverpool online program webinar. I hope you got to get an idea of what the MPH program is like here at the University of Liverpool. And we hope that if you have any other questions, or if you have any other things that you want to know, that you reach out either to an enrollment advisor, or you go to our University of Liverpool online website and check all of the information that we have on the MPH programs there. With this in mind, thank you everyone for showing up, and I wish you a very, very good day ahead and all the best with everything that you're pursuing this week and further this year. Have a good day ahead. Bye.
Bye.